you tend to do? You tend to take antihistamines. Who can think clearly with antihistamines, even if they are non-drowsy? So a much better approach, if at all possible, is to get rid of the original allergen. Now, treating illnesses. Boy, I have talked on, haven't I? Okay. This is a long list of illnesses that may be associated with any, diminution in brain function. Candida, syphilis, well, you'd think that would be pretty obvious, but it falls on the list of things people may not think about checking for anymore. It used to be that was on the admission panel when you got admitted to the hospital, and they don't do that anymore. But Candida infection, syphilis, streptococcus. This is an interesting thing, an interesting strep phenomenon I'll really go into a little bit next week. It's called pediatric autoimmune neural disorder associated with strep. Neuropsychiatric disorder, sorry. So pediatric autoimmune neuropsychiatric disorder associated with strep. These kids will get a strep infection and just begin to do, bizarre things. They may have, say if they're autistic, they may have increased stimulation activities. If they're door slammers, they may, increase that, or may lose, they may lose vocabulary. And it's a strep infection. And here's the interesting thing. The normal markers of a strep infection in the blood don't happen. The immune system is so messed up, they can't even respond normally to what is clearly recognized as an infection. So these are interesting things you have to take into account. Lupus needs to be treated. Your brain will work for it. Lupus is well known for having some psychiatric associations. But if we can get the lupus treated, the brain will tend to work better. Epilepsy, and to me this is one of those cycles. Do they have epilepsy because their brain doesn't work right, or is it sort of vice versa? Anything that you can do that's going to improve that is going to help the brain work better. Other diseases, porphyria, homocystinemia, phenylketonuria. We talked about that. There has to be dietary modification there. Thyroid, parathyroid. There's a disease called cretinism. That means you're low thyroid from birth. That's why all the states have screening for thyroid disease. But guess what? Even when you're an adult, you can have low thyroid, and you're actually more common. It becomes more common as we get older, and you're not going to be able to think clearly. You're not going to be able to make the right neurotransmitters. So thyroid is something else to look at, and parathyroid as well. And then the function with the pituitary and adrenal. But again, thyroid is going to be probably the most important one there. There are also organic brain disorders, and I've always wondered if there's, where do you draw the line, I guess is what I'm trying to ask the question with overlap. For example, if someone has had brain injury, well, I guess it's organic brain disorder, but, again, we still have to give the nutrient substances so that the trauma can heal itself, rather than just saying, well, heal the trauma and the brain will get better. So brain tumors, hydrocephalus, multiple sclerosis, Parkinson's disease. There's actually a nutritional component to at least MS. You've got to have plenty of vitamin D for multiple sclerosis to have the improvement there. Parkinson's disease, arteriosclerosis, atherosclerosis, and stroke. We mentioned that a little bit earlier, and the dementias. So what about these gastrointestinal disturbances? This is important because the number one class of medications out there is to treat gastrointestinal disturbances. And most of them don't actually treat the problem, they just Band-Aid over a symptom. If you have reflux, what you need to do is improve your digestion, not take an antacid. But what we will prescribe for people is an antacid, so that at least when the fluid from the stomach bubbles up the esophagus, at least it doesn't burn it with stomach acid. So to me, that's sort of backwards logic. What we really want to do is improve digestion so that the food is moving through. This may be with digestive enzymes, which is probably the single thing I've seen the most improvement with. Trace mineral deficiencies can have can really cause reflux and this indigestion problem. So these are very important. Enzymes, our bodies make less enzymes as we age. We don't have enough to digest our food. It sits there. It may putrefy in our stomach. We get this reflux. We have these, terrible heartburn, No, the key is not to take an antacid. The key is to improve the digestion. Malabsorption, again, improve the digestion. And malabsorption may be both due to not breaking the food down, as well as there may be other problems like biofilm, which is a little further down here. What about diarrhea? Well, guess what? If you've got diarrhea, you're not going to be absorbing the nutrients that you need. You've got to take probiotics. Enzymes are going to be an important component, again, of improving the digestion. Fiber, too, you may see things called prebiotic. That's usually a fiber source for the germs to grow on. And when you see a prebiotic and probiotic together, then they call it a synbiotic. And that's fine. It's basically going to improve the health of your entire digestive system. Constipation, another common problem. Now, I was taught in medical school, people are obsessed with their bowels, and that whatever their usual bowel habits are, that's normal, which is kind of silly. You're going to tell me that you have a problem, but I'm going to tell you that you don't have a problem because what's going on for you is normal for you. That's pretty silly, but that's sort of the way we were trained. The greatest health is going to be found with people who are having 2 or more eliminations a day. Not runny, loose stools, but 2 eliminations, because what you're doing is moving the food through so that it doesn't have time for these germs to collect and then get the germs to reabsorb into the body. You're eliminating toxins when you have a bowel movement. So you don't want them to stay in your colon and get reabsorbed into your system. You want them out of your body. So probiotics are going to be key there, as well as fiber. Improve the diet. You want to be eating fresh, raw, whole foods whenever possible. And digestion. Many of us are going to have to add in digestive enzymes. And they can make a tremendous difference, and sometimes even a long-standing difference. My first experience, the very first non-prescription thing that I ever took was a digestive enzyme. It was a combination of enzymes, of course. I was having trouble eating onions, and I loved onions, but the indigestion was so bad it would keep me up at night, and that's bad because I can sleep pretty well. So, but someone fed me 2 little digestive enzyme pills with the onions that I was eating and promised me it would all be okay, and I haven't had trouble with onions ever since. So it can make a significant difference. Now this concept of biofilm. The easiest way to understand biofilm is when you wake up in the morning and you run your tongue over your teeth and it feels sort of slippery. It's not your teeth. There's something over it. That is biofilm. And what it does in your intestines, this may not be true for everyone, but especially people with real challenges with digestion and absorption, they may have issues. They may have germs in there that have produced these these sheets of sort of mucopolysaccharides, and they're actually held together by calcium and magnesium ions, these positive ions, or iron even. And they form a film over the intestine and prevent things from being absorbed. So the nutrition going in may be perfect, but it's not being absorbed. The germs in the intestinal wall may get it, but the person, the host, does not. So sometimes these have to have particular protocols to help actually do away with that biofilm so the person can absorb things normally. And then there's specific infections that may have to be treated. Clostridia, Candida, they both may be populating the GI tract in such a way that the germs are getting getting the nutrition, but the body isn't. Now, other diets to look at, I mentioned gluten-free is what I meant to say, not glucose, gluten-free, casein-free and soy-free. But there are other diets that some people have looked at and had benefits with. Yeast-free, and that's for somebody who's got trouble with Candida. They would take no yeast-containing items, no simple sugars, which would have fed the yeast, and then enhance the